Hello, my name is Amanda Penalva, and this is my capstone presentation. Today I will briefly touch on my public health issue related to my capstone presentation, and I chose that my public health issue is environmental lead exposure in Omaha. And in Omaha, children, especially those of low-income families, are exposed to lead in their environment through several sources. One being through the soil, two being through lead paint, and then three being through lead-lined pipes, so their water source. The main sources of lead in the environment include the soil. So Omaha has the largest residential EPA Superfund site in the country, and this is a result of emissions coming from the lead refinery located in downtown Omaha which was in operation for more than 100 years. And also, a second source would be through lead paint. So lead paint was actually used in homes built all the way up through 1980 before it was banned, and then lead-lined water pipes, which were banned in 1986, but the old lead-lined water pipes were never taken out, so that continues to be a source of lead exposure through drinking water. And then I wanted to talk a little bit about the effects of lead poisoning. So lead poisoning can cause kidney failure, seizures, coma, and even death. And even at low lead levels, they can permanently damage or reduce a child's IQ, growth, and ability to succeed in school and life. So, blood lead screening of children in zip codes located east of 45th Street in Omaha, near the former lead processing facilities, have consistently exceeded the 5 micrograms per deciliter health-based threshold more frequently than children living elsewhere in Douglas County. So in 2017, which is the most recent year which data is available, 1.1% of the approximately 20,000 children tested in Douglas County between the ages of 0 and 7 years exhibited blood lead levels greater than or equal to that health-based threshold of 5 micrograms per deciliter. I chose this as my public issue because of my profound experience while providing free lead screening to elementary school children alongside NMC's Childhood Lead Program Initiative. This experience incited my enthusiasm for working with children, and it prompted my passion to help and advocate for disadvantaged populations experiencing health disparities related to environmental injustice. I also wanted to learn more about the issues surrounding those affected by the toxic effects of lead in my community and further explore what I could do to help them. Throughout my nursing education, the importance of living as an educated citizen has been reinforced through my classwork, my clinical, and community interactions. To demonstrate how I've developed in these areas throughout my time at Methodist, we will review the key components in this role, which are being a change agent, reflective individual, and effective communicator. And we will also look at how I've developed in these areas through clinical experience, as well as the connection to my public issue. So my first experience that I will review is my first reflection about becoming an effective communicator. Effective communication skills are critical throughout everyday life, in relationships, and in the nursing profession. Upon performing a functional ability assessment, which included questions about mental health with one of my patients in clinical, I proceeded to ask her if she had a history of any mental health disorders such as anxiety and depression. She quickly denied having any past medical history of anxiety or depression. Not wanting to pry or make her uncomfortable, I accepted her answers and returned to the nurse's station to further evaluate her chart alongside the nurse. After reflecting further upon this experience, though I had a good relationship with the patient and I felt we had developed a good rapport, I think that maybe the patient had been a little embarrassed to share her past medical history. And I think that if I had, implemented further therapeutic communication techniques, it would have further developed our trust in our relationship, and she would have been more willing to share her past mental health diagnosis with me. So what I learned through this experience is that through developing and applying therapeutic communication techniques, they aid the healthcare professional in maintaining effective communication, which also leads to a greater chance of positive patient health outcomes. This can tie back to my public health issue because it's important to use therapeutic communication, especially when caring for vulnerable populations and conducting patient education. Oftentimes, these populations already feel that their trust has been violated, that they, are just not in the best place, whether it be financially or environmentally. So it's really important to develop that rapport and use those therapeutic communication techniques in order to gain their trust and let them know that you are truly there to help them. During one of my clinical experiences as a student at NMC, I had the opportunity to use some of my Spanish-speaking skills in communicating with a patient. The patient was notably upset, and she only spoke Spanish. My nurse was having trouble understanding her, and since I have quite a bit of schooling with Spanish, the Spanish language under my belt, I decided to give it my best shot and see if I could understand what the patient was upset about and how I could help the situation. And it turned out that there was a man that was walking outside her window of her hospital room. Her blinds were open, the window to the hallway, and he kept walking back and forth and peering in her window, and it was worrying her. She didn't know who he was or why he kept trying to look in her room. So I was able to understand that from what she was communicating, and then I went ahead and me and the nurse closed her blinds for her, and then we also found that the man walking in the hallway was a maintenance man, and since the patient's lights were off, he was trying to clean the room, and he wanted to see if there was anyone in there. So we just let him know that the patient was in her room and that her room didn't currently need to be cleaned, and thanked him. We also let her know that we would close her blinds, and she seemed much more comfortable with that and much more comfortable in her environment. So this learning experience taught me that speaking with patients in their native language allows for care plan collaboration and trust building. And in terms of bringing that back to my public issue, my Spanish speaking skills, alongside any further conversational Spanish speaking skills I choose to develop in the future, will help me to eliminate language barriers and promote effective communication when interacting with patients in the community setting. My first experience as a reflective individual involved showing me the importance of trends in health assessment data and how charting these trends in vital signs or assessment data over time allows healthcare providers to analyze the objective patterns or changes in patterns to determine patient status and the best plan of care. So during this particular experience, the phlebotomist performed a blood draw on the patient, and he was already in critical condition. His pulse oximetry reading dropped almost immediately after the blood draw was taken. We evaluated a few different things that could have caused it, but overall he was in such a significant fluid deficit that the further blood draw caused that drop. So then we were able to assess what best intervention to make after that. So overall, the thing that I learned from this situation was that trends in assessment data are important indicators of overall health, and they can indicate changes to the patient's health status on a deeper level. So in tying back to my public issue, many children experiencing lead poisoning have no acute physical symptoms at the time of exposure, but potentially permanent damage can still be occurring. This is why it's important for healthcare providers and families to recognize changes in patterns and trends of these children so that prompt medical intervention can be performed before further damage occurs. Also, in learning to recognize these changes in patterns is another reason why it's helpful to provide patient education to the parents in these families. And so that they can recognize when something is wrong, and that testing for lead exposure should be considered under certain circumstances, which would be provided in that patient education. My next experience came about when I had the opportunity to go with Nebraska Methodist College Childhood Lead Program Initiative to perform free lead screening for children living within the Omaha Superfund site. We went to an elementary school in North Omaha and performed this free lead screening to assess their levels and find if any children were above the health-based limit, and then get into contact with their parents so that we could provide them with further education and resources that were available to them. So what I learned during this experience is that Omaha has the largest Superfund site in the country, and it disproportionately and adversely affects the health of disenfranchised populations such as minorities and low-income families within our community. There's an urgent need because prevention is the number one intervention for preventing lead toxicity, there's an urgent need for community education regarding heightened lead levels in Omaha to help people understand the serious health implications for kids and to provide them with options for screening and treatment. Research and reflection on my interactions with these patients at the street level helped me to build a broader perspective and comprehension of an issue that negatively affects the health status of my community. This experience illustrates my ability to use logic and critical thinking skills in the field to comprehend how to best interact with these patients at the street level through therapeutic communication and how to help meet their needs for resources and patient education. In my first change agent experience as a CNA, I took appropriate initiative to effect change for a patient with Parkinson's disease. The patient and I worked as a team to promote and implement the necessary lifestyle and wellness habits in a way that respected his cultural rituals and values. We also balanced his schedule, and we worked to maintain a plan that fostered a positive attitude and motivation to enable him to reach his goals. At the end of my time with this patient, he had made dramatic progress. So one of the biggest barriers and learning opportunities in acting as a change agent for this patient was that of cultural competency. The role of the nurse as a culturally competent healthcare professional is to ask the right questions of their patients, specifically the 4 C's. This is something that I learned in my cross-cultural communication in healthcare course at Nebraska Methodist College. The 4 C's include asking the patient, what do you call your problem? What do you think caused it? What concerns you about it? What concerns do you have about my recommended treatment? Cultural competency of the healthcare professional is necessary when providing interventions because adjusting to a patient's cultural preferences puts the patient at ease and aids in promoting better health outcomes. As far as a tieback for my public issue, using my cultural competency skills to help families implement personalized interventions in a way that is compatible with their health practices will further promote positive health outcomes. My last experience involved providing interdepartmental support for a homeless patient facing health disparities. During this experience, I learned collaboration skills. This would tie back to my public issue well because collaborating with Douglas County Health Center to provide adequate resources and support for families in need would come in handy when providing community support for lead exposure. While earning my nursing degree at Nebraska Methodist College, these experiences have aided in my progression towards the goal of becoming an educated citizen. Through personal reflection, improving upon my abilities as an effective communicator, and gaining an understanding of the nurse's role as an agent of change, I have developed and improved upon skills of introspection, conversation, and action on my path to becoming an educated citizen. Here are a list of my references I used for the presentation. Thank you.